Hey folks, it's Andrew from Gemba Red, and today I'll be speedrunning all the red light therapy dosing considerations that are important of various variables that you can be experimenting with a little bit higher, a little bit lower, to see what's the optimal dosing protocol for you. Okay, so I broke this up into 3 phases. Phase 1 is understanding the dose is the joules per centimeter squared, also known as the fluence or the energy density. If the only thing you can do is calculate your joules per centimeter squared, you could use my dosing calculator to help with that. Get your doses in a reasonable range of joules per centimeter squared, 2 to 10 for skincare, 10 to 50 for deeper tissue stuff. Start on the lower end of the ranges and see if that works, and then increment up. Now, the second phase is my preferred way of considering it, is just having the correct range of intensities and the correct exposure times. So you can have too much intensity or too little intensity, and that's not effective. You can have too much exposure time or too little exposure time, and that's not going to be effective. You want the Goldilocks dose for both intensity and exposure time. And in many ways, that's a lot easier because you don't even have to do math. Just get an appropriate intensity, appropriate exposure time. You can double check the math with the joules per centimeter squared, but it's not always necessary. Okay, phase 3, we just dump all the other parameters into phase 3. And so in a rough order of what I think is the most important to the least important, number 1 is intensity, number 2 is exposure time, number 3 is your fluence, number 4 is how often do you do it? Do you do it multiple times a day, every other day, a couple times a week, a couple times a month? Those seem to be, all kind of clinically studied options. So again, try to experiment with doing it more frequently or less frequently. A lot of times, less is more, especially once you understand the cumulative dose response. And the next one is, how long are you going to be doing red light therapy? Are you going to be doing it for a couple weeks, a couple months, for many years, for the rest of your life? If you think about most studies, they're only limited to a couple weeks or a couple months on humans. In some cases, if you have an acute issue, a wound that needs to be healed, or an acute inflammatory issue, you'd be doing it over a certain number of weeks. If you have a chronic condition, you might be doing it for months or years. And then the coverage area. Are you doing a targeted device, a full body device? Different sizes of devices are important. And, what's the area that you need to be treating? Is it just one small spot and you can just use a targeted device? Or are you just trying to do your whole body for some sort of whole body issue? The coverage area is quite important. And then the total power and the total energy delivered per dose is also very important. That plays into the coverage area. So you multiply your fluence times the coverage area and you can get your total joules. And that's going to be a very important way of considering dosing in the future that's often overlooked. So what's your total power of your device? What's the total energy that you're absorbing? And it's not dividing by the area. So the next one is relatively new. It's the photonic fluence. This takes the joules per centimeter squared and then multiplies it by the EV of the wavelength to kind of give you a weighting value for the effectiveness of the wavelength times the dose, because generally shorter wavelengths are more photochemically active because they have higher electron volts. And then time of day is becoming a big topic of conversation about red light therapy. There's a lot of indications that doing red light therapies in the mornings is very efficacious, and it might be less efficacious in the afternoon or evenings. But again, everyone gets different results. Experiment with different times of days. And the mode of application of red light therapy is important. That's what they call either referring to continuous wave or pulsed. So continuous wave is kind of the standard. It just means the intensity is relatively constant throughout the entire exposure time of your dose. And pulsing is that modulation of the intensity of the ups and downs. It's kind of a rapid on and off, and then you get a whole slew of additional parameters once you start getting into pulsing: the frequency, the duty cycle, the average intensity, the peak intensity, all that good stuff. Then the application mode is also very important. We have skin contact, we have distance treatment, scanning mode of kind of moving the device slowly back and forth. And so the application mode also plays in a role of choosing what kind of treatments you're doing and what's the effectiveness and what's the depth of penetration and the absorption and skin reflection losses. So the application mode is important to consider. Then the type of device or the type of light that you're using is also important. Is a laser, incandescent, LED, or fluorescent? Different types of lighting and lighting technologies have some inherently different optical properties. The spectrums, the wavelengths are inherently different. Lasers have speckle and polarization and coherence. Incandescents are more broad spectrum. LEDs are quasi-monochromatic. Fluorescent have kind of a crazy spectrum. So again, that can inherently play a role. Like, you can kind of ignore that and just say, oh, just, as long as you can lock in your wavelengths and all those other parameters, it doesn't matter as much. You could have an incandescent, but with some fancy filters to isolate certain wavelengths. So that's theoretically possible, but it's, kind of impractical when you could just use an LED. And then heating or cooling, if any, because most of photobiomodulation and low-level laser therapy is non-thermal. So there's no temperature change, practically no temperature change, maybe less than a 1 Celsius degree change at most. And of course, there are proponents of heating where maybe people are trying to do some sort of combination of photobiomodulation and heat therapy, or maybe you're just tolerating heat because you want to have higher intensities, which inherently causes more heat. But of course, we could also consider the opposite, that there may be benefits to cooling, of reducing the ROS from double dipping on heat therapy and PBM therapy. Pulsing and scanning techniques are also methods of reducing the thermal load and allowing for thermal relaxation. There's also some studies that indicate you could cool the skin by aiming a fan, like just cooling air. Devices are built in with a fan that keeps the device cool, but you could also get an extra fan and aim it at your skin to keep yourself cool. This should serve as a very good outline, a very good starting point of all the parameters that we can juggle to reach that optimal dose. And again, just start with the simple, start with phase 1 or phase 2 and get those in the right ranges, and then work your way up into more complexity. Okay, thanks for tuning in.